Hello there. I'm Kate Walsh, and I'm here today with Dave Maffeo, Senior Director of Support Services here at Boston Medical Center. So, Dave, you and I have spent a lot of time in recent weeks as we've prepared for and responded to this pandemic. And because we're in a phase C of the hospital incident command structure, your role, which is pretty broad on a regular day, has taken on additional dimensions because you are the logistics chief.
Yes.
And much of our response to this pandemic has been all about logistics. So could you take a minute and talk a little bit about what you do in that role? And then I have a few more questions for you.
Sure, absolutely. So the logistics chief's role is really to make sure we have supplies readily available, people deployed when operations need it, food, so on and so forth. So during this whole event, it's very supply driven. So we're making sure that we're vetting companies, making sure products are ready available to the floors when they need it.
So I get like 100 emails a day, and you must get 300 emails a day, all of whom say, I've got a guy and he's making masks. Yes. So talk a little bit about when we get one of those emails. They come from really famous people around town, and they come from people who have something in their backyard or in their garage. Talk about how you decide whether a mask is fit to go into our supply chain.
Sure. So what we do first is we vet all the companies. So Scott Rutledge and his team, they've made over 250 calls to these companies that had a guy that had a mask. And then when we bring them in, I make sure that I bring them to infectious disease to vet them. So like we did for the surgical masks that we're passing out every day. In N95 mask, Bob Whitfield and his team, they look at the masks and they fit test accordingly. And there has been some masks that we just haven't accepted just based on the efficacy.
So you and, say, Dr. Nahid Bedelia will look at a mask, run it through a test, and say this works or this doesn't.
Absolutely.
So if there's a mask that's on a floor at BMC or in one of our lobbies that we're putting on somebody, your team and the physician leadership have certified that it's safe to use.
Yes, we have vetted all masks, face shields, any other PPE. And we've also changed the process a little bit so it comes through transport, which is under my domain on a regular basis anyway, so I keep a close contact with them.
So staff don't have to go looking for it, you're supplying it.
We're delivering it.
That's terrific. You know, I don't think I realized that you were quite an expert on like what kind of cleaning solutions need to be used for what services. It's really been just remarkable to see the teamwork around this. Yeah. I want to thank you for all your hard work. Thank the supply chain team, who I know I personally interacted with on many more occasions in this event than I have in my 10 years of working here. And I want to thank everyone for tuning in, understanding just how things work behind the scenes here at Boston Medical Center.